Had my husband there, he had paternal time, paternity leave. It was only for 2 weeks, but he had paternity leave.
We're getting better.
Yes. Welcome to the Twin Sisters Docs podcast. I am Dr. Delana Wardlaw.
I am Dr. Elena McDonald.
And together we are the Twin Sisters Docs. Today, Dr. McDonald, we're going to talk about something that is very important: mental health. And so mental health is an area of our health that can not only affect our emotions and our behavior, but it can also have an impact on our physical well-being as well.
Yes. So when we talk about mental health, Dr. Wardlaw, what are the things that we should think about when we're considering mental health?
Thinking about how we control our emotions, how we react to other people's emotions, and consider how we behave in certain arenas and or situations.
Yes.
And so mental health can come in a variety of conditions. So there can be like anxiety conditions, whether that's anxiety disorder or panic disorders or OCD.
Yes, which is obsessive compulsive disorder.
Yes. There could be mood disorders, where you have depression. There could be eating disorders. That's a mental health disorder. There could be schizophrenia, where you not only have some emotional issues, but you can also have like hallucinations, whether you're having visual hallucinations where you're seeing things that other people don't see,
or you're hearing
whether you're having auditory hallucinations where you're hearing things that other people aren't hearing.
Self-harm should also be considered when we're talking about mental health. And when we talk about self-harm, individuals who cope in a manner that's unhealthy.
Yes.
And self-harm could present itself as individuals cutting themselves. We tend to see that in a lot of our teenagers when there are situations that's going on in their lives, and that's how they choose to deal with the situation. So self-harm is important to recognize and to address.
Other conditions that we also are also in the mental health arena: post-traumatic stress disorder, or PTSD.
So when there's a traumatic event that has occurred, then it can often lead to feelings of anxiety or depression after the event, and that's called post-traumatic stress disorder, which needs to be addressed.
Yes. And also substance abuse disorders.
Yes.
So whether it's alcohol addiction or whether it's a drug addiction. So these are also classified as mental health disorders as well.
Now, when we talk about mental health, how do we recognize it?
So one, you may not recognize it.
Exactly. Some others may recognize it who are around you.
Someone else may recognize it. They may recognize that your behavior is changing, that you are acting more erratic, or that you're acting more withdrawn. So it could be on either end of the spectrum. It could be that you are making irrational decisions, that you are very irritable. So those are situations where you're just not the usual person who you normally are. And it is not just 1 day or 2 days. It's repeated behaviors that people are starting to notice over this change.
And months.
Yes.
Sometimes it could be over years where people just don't recognize the symptoms. And also we can see things such as changes in your sleep pattern.
Yep.
People who were pretty active and moving around are sleeping all the time.
Yep.
Or now they're up all the time because they can't get sleep. Or changes in their eating patterns where they're no longer eating as much, or they're eating much more as they cope with things that are going on in their lives. Oftentimes you can see it in work and school. We see sometimes our children's grades start to go down because they're no longer as focused as they need to be. They're not concentrating. They're not completing their assignments. That can also spill over into the workplace as adults. You are no longer as focused as you are, completing your task as need be. But also
another sign that you could be having some difficulties or some challenges is that you're losing interest.
Yes.
You're not as motivated to do what you normally do. It sometimes becomes a challenge to get up and get out the bed, to get yourself dressed, and or get up and get yourself, your children off to school. that becomes a challenge. You lose your interest in doing things that you're typically interested in doing. You're used to going to the poetry night with your friends, or you're used to going to a
book club,
book club,
chess club.
Yeah. And so you're just not interested in those things or those activities anymore. So those are two signs that can be subtle, but those are also
telling signs that we should be aware of. And for parents, I always say, you notice that your children are losing interest in the things that they love, not the things that you want them to do, but the things that they actually love. For example, if you had a child who loved to dance, no longer is dancing. You had a child who was football, basketball, soccer. They're just not into it anymore. They've lost their interest, or they're not hanging out with their friends the way they used to. They were drawn to their room and they used to be very social. Those are changes that we need to be aware of. And again, it's not your job to diagnose, but it's your job to bring it to their doctor's attention to see if something is going on. And when we talk about mental health, we need to figure out what are the underlying causes of mental health.
And there are some other signs, too, that are huge red flags, like suicidal ideations. Like if you are thinking of harming yourself and you have a plan, you're thinking about taking a bottle of pills, or thinking about using a weapon to harm yourself, or if you're thinking of harming someone else. So those are signs that are more
that requires immediate intervention. If you become a danger to yourself or others, that requires immediate attention. And please don't hesitate to reach out to someone and talk to someone if you need help, because there are lines that you can call. 988.
Yes.
That is a national number that you can call for mental health. That number is available 24 hours a day, 365 days a year, whether it's 4 o'clock in the morning, whether it's 2 o'clock in the afternoon, Saturdays, Sundays, holidays, weekends. Yes, if you are feeling like you need to talk to someone, pick up the phone. There's always someone on the other side of the phone. They're not there to judge you. They are there to help you to get through the situation that you're going through.
You can call and or text.
Yes.
They also take text messages as well. And there's, again, as Dr. McDonald said, there's someone on the other end of that text or that phone call. You can also go to a crisis center.
Yes.
And if you're not sure of where a crisis center is, go to the nearest emergency room so that you can get the help that you need. Now, those are, cases where you are in immediate danger, or you really feel like things have really you've gotten to the end of your rope and you need help immediately. But it does not always have to be on that end of the spectrum. Right. We've always talked about these other subtle signs that can also be a
symptom or sign of depression or anxiety or mood disorder.
Yes.
And we always say that, again, it's over time. Yes, you should be anxious about certain things. Yes. You should be nervous about certain things. You will be sad about certain things that's going on in your life, but it shouldn't be constant all the time. You should be nervous about that test that you have to take. Yes. You should be nervous about that presentation that you have to give. You should be nervous if you're going to take a driver's test, because if that is normal.
Yes.
You should have a level of anxiousness and pause if you see a dark alleyway, you see some shadows in that alleyway. Yes, that is to protect yourself.
Yes.
Okay. But you shouldn't be anxious every day about everything, because that's not normal.
Yeah. And also to the point where it is preventing you from being able to do your
normal activities.
Be productive. Being productive, being able to take care of yourself, your children, your household, being able to do your job in a productive manner.
Your schoolwork done,
perform
on your sporting team,
yes,
your dance team, yes, your cheer, your gymnastics team. You don't want those feelings to prevent you from doing those things. We will be sad about things.
Yep.
That is normal. When certain things go on in your life that makes you sad, but we don't want you to be sad all the time.
Yes.
And there's another phenomenon that we need to address: postpartum depression.
Yes.
Postpartum depression is real, and it occurs and it doesn't have to be a new mom.
Yes.
I tell my families, it could be the first baby, it could be the fourth baby.
Yes.
postpartum depression can show up at any time. Now, when you have a baby, babies are overwhelming. They are exhausting. You are in a chronic state of sleep deprivation.
Yes.
There are days you feel like you want to cry. There are days that you question whether or not you can take care of this baby. That's all normal. But you shouldn't feel like that every day.
Yes.
You shouldn't be sad every day, all day, crying every day, all day, feeling anxious, feel like you can't take care of the baby, or you don't want to take care of the baby.
Or you want to harm the baby.
Or you want to harm the baby.
Yes.
If you are feeling like that, we absolutely want you to reach out to your doctor, because postpartum depression is real and it does exist.
And that's why it's good to have a good support team, family, friends. You can call someone and say, hey, I'm having I just need some sleep. I need to get some rest. I need some time away. I just need some time.
Can you come get the baby?
Can you come and get the baby?
For 2 hours.
Can you keep an eye on the baby while I take a nap? And so being able to have those supports in place is very key. I remember being a new mother, and I have a set of twins, and I just remember being very overwhelmed. And I just felt, even as a physician, and I just felt like for the first 6 weeks of their lives, I didn't think I was going to be able to get down the steps. I could not get down to the first level of my home. And I kept saying to myself, you're not the first mother of twins. You won't be the last mother of twins. So you have got to figure this out.
Yes.
And I'm trying to figure out, how am I going to get back out to the real world? I had my husband there. He had paternal paternity leave. It was only for 2 weeks, but he had paternity leave.
We're getting better.
Yes.
Some companies are getting better with paternity leave.
And so I just remember being so
overwhelming.
I remember being sleep deprived. I remember one day, one of the babies was sneezing, and I thought the baby had a cold, and I was crying uncontrollably. And so I called my mother. And then my mother told me to just calm down and relax. But she also sent Dr. McDonald to my house. And Dr. McDonald came to my house and told me to go to sleep while she kept an eye on the baby.
Yes, you need a nap. You're overwhelmed, you're tired, and let's just get a nap and let's reset ourselves. So, like I said, babies are a lot of work and they're overwhelming. But again, you're going to have those moments. Mm-hmm. But in general, you should be happy to take care of your baby. So we want to recognize postpartum depression. And sometimes, again, the mother may not recognize it.
Yes.
But the baby's father, your husband, you're the grandmother may recognize these changes.
And you have to, too, recognize that, sometimes it's, the woman is emotional. It's just the baby blues. Well, no, this could turn into a significant situation that does have to be addressed. You have to seek attention from your physician, and you have to rely on your support systems. And it's not just for the first couple of weeks of the
pregnancy.
Postpartum. So postpartum can last for several weeks, several months after the delivery. So please be aware of that.
And in our office as pediatricians, they give out questionnaires. They have specific postpartum depression questionnaires that they will give the mother in the hospital. But we see the baby before the mother goes back to her doctor most of the time. So we also give out these questionnaires. Almost every visit when the baby comes in, pretty much every visit that the baby comes in, we're giving the mom this questionnaire because we're checking in on her.
Yes.
We're checking in on her.
Because the reality is, mom has to be able to take care of herself before she can take care of her baby. So please be mindful of that. And please know that it is okay. It is okay
to not be okay.
To not be okay. It is okay to ask for help. So thank you for bringing that up, Dr. McDonald.
And when we talk about depression and anxiety, there's often questionnaires that we as pediatricians, we give out to our teens just to have them fill out the questionnaire to see how they've been feeling over the last few weeks. Have you been down all the time? Or have you lost interest? Are you having problems sleeping? Do you feel tired all the time? Has your appetite changed? Are you eating more? Are you eating less? Do you feel like you want to harm yourself? Have you had thoughts of harming yourself? we give those questionnaires to our patients, and sometimes that opens up the door to a conversation that they may not otherwise say to us during their visit. So there are screening questionnaires that we do give to our patients to try to help identify those who need help. Now, you do have to pay attention to the questions. Teenagers are sleeping all the time. You have to ask them, are you up all night on your phone? So you have to make sure that you are, asking questions on top of that questionnaire to figure out, is this really an issue? And if it is, how do we get you the help that you need? Because your mental health is just as important as your physical health.
And just as you do questionnaires for your teens, we also do questionnaires for adults as well, because again, you may not be aware. So that allows us to be able to open up the discussion and investigate or explore some symptoms that you had brought to our attention once we go over the questionnaire.
Yes. And there's nothing wrong with getting help. And some communities it's taboo, to get to discuss mental health, but you have to discuss in order to get the help that you need.
Yes.
Some people rely on their religion. Absolutely, you want to rely on your religion. No problem to rely on your religion, but you also have to get the professional help to help you get back to where you need to be.
And seeking professional help is getting an objective professional opinion. Yes, you could talk to your family, you could talk to your friends, you can talk to your religious leader. However, you need a professional, objective evaluation. You need a professional, objective evaluation so that you can get one, if there is a diagnosis, you can be properly diagnosed. Two, if there is treatment that is recommended, whether that is therapy or whether that is therapy and medication, because not everybody's going to need medication. I think that therapy is very important. All of us can benefit from a therapist because we all have stressors in life. And so it's when the stressors go beyond our control that we can't manage them, that we start to have these challenges where we start to develop symptoms that will lead us to these diagnoses. So again, it's okay to not be okay. Everybody probably can benefit from a therapist. We all have stressors in life. But sometimes the stressors become so challenging that it prevents us from being able to cope in a normal fashion. And then that's where the professional comes in, so they can give you coping mechanisms so that you don't go into a spiral where these symptoms become so drastic that now you are ill and you can't take care of yourself or those who are dependent upon you.
So Dr. Wardlaw couldn't have said it any better. It's okay not to be okay. And there are definitely resources out there. Please talk to your doctor to determine what is the next best step for you.
So we also want to talk about eating disorders, because eating disorders is really a situation where it's not just about the food, but it's about really feeling like having control of the food.
The eating disorder not only impacts your body physically, but it has a mental aspect to it also. And when we talk about eating disorders, we're talking about things like anorexia, bulimia. There could be a combination of anorexia and bulimia. Or food restrictive disorder. Or sometimes people, they will eat and then they will exercise excessively to try to burn the calories. And then the eating disorder, again, you have to have proper nutrition in order to be healthy. And with the eating disorder, it creates an imbalance. And it can create fatigue, lack of concentration, but it can also impact, if you are excessively vomiting, it can impact your esophagus. It can impact your teeth. We can see rotten teeth from the acid that is breaking down your teeth.
It can cause severe dehydration. It can cause you to go into kidney failure.
It also can affect your heart. So eating disorders can cause severe physical problems. But again, with the eating disorder, there's a mental component to it that must be addressed in order to effectively address the eating disorder. And a lot of times it requires intense outpatient or sometimes inpatient treatment to manage the eating disorder.
Yes, it involves a team.
It'll involve the dietitian. It will involve not only the medical doctor, it'll involve the therapist. Sometimes it may involve the psychiatrist. There's a whole team that has to manage this eating disorder.
Yeah, because sometimes you'll have a situation where people have to become readjusted to their relationship with food.
Yes.
And being readjusted with feeling that it is okay, that the food is not their enemy.
Yes.
That the food is providing the proper nutrition so that they can function, and helping them to realize that if you don't provide it, then you're doing a detriment to your body.
Yes.
Not only physically, but if you're not eating and you're not providing the proper nutrition, it affects your productivity. It affects your concentration. It affects your ability to be able to focus. So it affects your sleeping habits. So it has a litany of results that can come from not having a healthy relationship with food.
Yes. And it's also important to remember that eating disorders, for a long time, people would say it really affects Caucasian women.
Mm-hmm.
Eating disorders can affect
Anyone.
any ethnic group,
Mm-hmm.
and not only women, but men also. So we have to be aware. We have to be aware of these things. We have to keep it on our radar and recognize that it can affect anyone. But again, we want to put people in a position where they feel comfortable discussing why they have certain behaviors, or they may not know why they have certain behaviors. That's where the therapy comes in at. So recognizing that it may be an issue, or it is definitely an issue, and getting the help that is needed.
And so what you said was key, Dr. McDonald. It could be an underlying situation or a past experience that one has experienced that is causing this unhealthy relationship or behavior when it comes to food. And so, again, the therapist helps to, as we many times say, helps peel back the layers of the onion.
Yes.
Because it may not always be obvious. It may not always be at the surface. And you may not be able to figure it out.
Right.
And so that's where professional help
Is critical.
Yes.
To help deal with these disorders or conditions.
I think the last thing I'm going to talk about, Dr. McDonald, is substance abuse.
Okay.
Because substance abuse, and we have this conversation all the time, I don't know one person that has chosen to become an addict. Again, that is a situation that comes from being involved in behaviors that become addictive before many even aware that they're addicted, and then it
Takes control of their lives.
takes control of their lives. And so people have to be aware that many times too, that is associated with past experiences or current lived experiences that they may be experiencing, whether it's stressors, whether it's challenges, whether it's trauma, past, present, whether it's financial situations. So it could be a variety of situations that can contribute to one using medications. Using
It could be illicit. It could be illegal drugs, illicit drugs,
or it could be prescribed.
or it could be prescribed drugs.
Yes.
So substance disorders is not just illegal drugs.
Yes. And so you just can't think of an addict as someone, being on the street who's panhandling and, they are out there using illegal drugs. There are many people who are addicted to prescription medications, and that also causes them to go into a pattern of this addiction causes them to do things that affect their lives, affects their ability to be able to take care of their families, affect their ability to be able to go to their jobs, even though they know that if they use this substance, it's going to affect their ability to be able to go to work.
Yes. They still
do it anyway.
Because again, as you said, Dr. Wardlaw, no one wakes up planning to be addicted to drugs. Some people become addicted to drugs because they thought it was cool to try certain drugs. And as I often remind my patients, yes, someone may come to you and say, try this, try that. But a lot of people end up under bridges, living under, train stops, living on the street, because they started off trying things in a social environment because they thought that it was cool.
Yes.
And no one planned for their life to end up like that. And an addiction is a condition that has to be managed. It has to be treated. Most people cannot just cannot deal with their addiction alone.
Yes.
So we have discussed anxiety, depression, postpartum depression, eating disorders, substance abuse. And again, it is okay not to be okay.
If you have anxiety, it can cause a variety of physical illnesses. It can cause
Pain, shortness of breath,
heart
racing, yes,
numbness, tingling.
yes,
Sometimes you feel like the world is closing in on you. You
Yes.
feel like you are going to die.
yes,
So it can affect you physically. Sometimes you can have a litany of GI side effects.
diarrhea, vomiting, constant stomach ache. So all of those things, again, your mental affects your physical. Your physical can affect your mental. Some people who are in chronic pain can become depressed.
Yes.
As they're dealing with their chronic pain. So a lot of times there's multiple things that's happening that have to be addressed.
Or chronic medical conditions
In general.
in general can, cause people to, have some issues with depression or anxiety.
If they're not able to live the life they previously lived, that can certainly lead to depression. That can lead to anxiety. So you're correct, Dr. Wardlaw. So a lot of times it's just not one thing. It's multiple things that has to be addressed.
And I will also say that there's this old adage that, oh, it's not going to happen to me. Oh, I'm different. Oh, it's not going to happen to me. None of us are exempt.
Yeah.
None of us are
It happen to
immune.
any of us.
It could happen to any of us. It can happen to the best of us. So please be mindful of that if you think that you don't have the ability to become a drug addict, it can happen to any one of us on any given day. So please keep that in mind.
Well, thank you for joining us today. We will see you on our next podcast.
Well, that was more than 2 minutes.
We'll get to find the time, Chief.